for coming to this seminar. It's a great pleasure for me to be here in New Delhi. It's my first time in India, so it's absolutely a delight to be here with you. Thank you, sir, for mentioning the issue of accountability in research. You make actually a very nice transition, and you help you make my transition much easier, because indeed this presentation is about accountability, and it's about transparency and reproducibility of impact evaluation. I would like to very briefly introduce myself. Thank you, Diana, for already introducing me, but I just want to say that actually MetaLab and BITS, the Berkeley Initiative for Transparency in Social Sciences, are two different things. I am a catalyst of this organization, so BITS, that's paid for my trip, basically. That's thanks to them that I'm here with you. And so Berkeley Initiative for Transparency and Social Sciences, they are based in California, and they fund research and education and workshops and training sessions like this one on the issue of transparency and integrity in science. And MetaLab, which is the organization that I head in London, so at MetaLab we do research on research. So we're interested in how researchers make research decision, and how is it that sometimes researchers do good research, to simplify, and why is it that sometimes researchers do not so good research, I mean, again, to simplify. And this is based on meta-analysis. So I just want to say that my background is in social policy evaluation. So I worked as a policy evaluator for 10 years, and now I'm less involved in the policy research part and more involved in the academic research environment, where I do a lot of systematic reviews and meta-evaluations. So which means that actually the type of work that I do, to clarify, I do a lot of meta-evaluations and systematic reviews, which means that unlike many of you here, I'm not involved anymore in evaluations where you look at participants in your experiment and then you see what happens to them. I do research on research, so I look at studies and how they are designed, basically. So just to say that I know that some of you will have questions about de-identification, which is a big problem or a big issue in impact evaluation and in transparency. But I don't have first-hand experience in data de-identification, so I'm not going to really address this specific issue today. So it's a short presentation, and in this short presentation I just have one single message that I want to share with you, and this message is here on screen. So the point that I want to make and defend here with you is the following. So over the past decades, evaluators have made great progress, I would say, to improve the robustness of their studies. And I would argue that to maintain or enhance their credibility, they now must make their research transparent and reproducible. That's the point that I'm going to defend. And this presentation will have three parts. First, I'd like to define to you what I mean by transparency and reproducibility. Then I will outline what I think is the problem currently in social research, but not only in social research, I think in research in general. And then I would like to show you some solutions. Two solutions. But first, the definition. So what do I mean by transparency and reproducibility? I'm going to start actually with a word that I'm not going to use so much today. It's about the idea of replication in research. So according to Roger Peng, who is a biostatistician, so the replication of scientific findings using independent investigators, methods, data, equipment, and protocols is the standard by which scientific claims are evaluated. So the first term I'd like to show you and define is the term of replication. When you replicate a study, you run the study again. So you could do an evaluation in a different contexts, and you can use the same protocol and collect and use a different sample. Or so this is the meaning of replication. You run the study again. You run the experiment again. The problem is that in many studies cannot be fully replicated just because who would pay for replication studies? I know 3IE does, but there are very few organizations that are interested in replication. So it's sometimes very difficult to replicate studies simply by lack of time or resources. So I would argue that there's a need for a minimum standards that can fill the void between full replication, which is ideally what we would like to do, and nothing on the other hand, which will what happens if we don't do anything. And Richard Peng introduced or suggested the notion of reproducibility. And so reproducibility requires that data sets and computer codes be made available to the public at large for verifying published results and conducting alternative analysis. So reproducibility is publishing, by extension, I would say, reproducibility is publishing your research files, your questionnaires. I would argue not just the codes and the data, but it's more than that. It's publishing your questionnaires, it's publishing your code books, it's publishing your command files when you have some, etc. So that an independent researcher using all these tools can see if he comes to the same conclusion as you. And transparency, so today I'm going to talk about transparency and reproducibility. Transparency is something else. And to be honest with you, the definition is not as clear, in my opinion, as for reproducibility. In my opinion, transparency is about the logic and motivation. So transparency is about, for example, the following question. So why did I perform a particular analysis? So why in this study did I report this analysis and not another analysis? And there are two reasons, theoretically. So it could be that we report an analysis because we report our results. So we want to test a theory. So when we started the study, we knew exactly what we were looking for, and we just report what we find, So we publish all our results. And another theory is that we only publish the results that are convenient. Okay, so I see some of you smiling and nodding, so apparently it's not unheard of, just publishing some of the results that, are convenient to us. Now, what is the problem? Not just according to me, but according to people who, like me, are interested in meta-research. I want to acknowledge first that over the past decades, evaluators have made great progress to improve the robustness of their studies. And I just want to give credit to these organizations that are on screen here. So 3IE, JPAL, SEGA, which is the Center for Effective Global Action, and IPA, which is Innovations for Poverty Action. So these four organizations, and there are more, apologies to the CEA foundations and others who also do a lot of research in this field. So thanks to these four organizations and others, we have now a great number of fairly robust, at least from the point of view of internal validity, fairly robust studies. Think about the situation 10 or 15 years ago. We didn't have, I would argue, so many robust and sufficiently powered studies as we have today. For example, before I came here, I had a look at the website of 3IE, and I can see they have a registry and a repository of all of a number of impact evaluations, and in their database you can find 4,260 impact evaluations. I was really impressed when I saw that number, over 4,200 impact evaluations. So I think I want to acknowledge this. So I'm not saying that we haven't done anything. I think we've done a great amount of work. And doing some further checks, I found out that nearly half of them, actually 1,900 of these studies, impact evaluations, are RCTs, which some people, not everyone, regard as the gold standard. But this is not the point in saying this. I just want to start the presentation on a positive note by saying that, if you believe in internal validity and if you believe in the gold standard, that's not my point. So you would see that a lot of progress has already been done, but I would fully acknowledge that, some people do not agree that, RCT is the gold standard. I agree with that. So I'd like to, really the point that I want to make in this discussion is the next step for evaluators would be to improve the reproducibility and the transparency of their research. So is research reproducible? Well, according to meta-researchers, well, there's room for improvement, as they would say. So for example, just going to show you briefly three studies. So according to the study that I'm showing on screen here, a group of economists tried to replicate lab experiments. So they sampled, I think, 20 lab experiments, and then they tried based on the information in the report, and then sometimes they had to contact the investigators. They run the analysis again, and they just wanted to see if they found the same results and if they came to the same conclusion as the authors. And according to that study, 40% of the studies in this sample could not be replicated. So they had the recipe, but they couldn't make the same cake with the same recipe, if you like. Is it high? Is it low? It's for you to decide. Now, the second study is in a different discipline. It's in the area of psychology. But here in this area of psychology, it's not so good. It would appear that according to this study, it's half of the sample. And in this case, that is not reproducible. And in this case, the sample is quite large. It's over 200 studies. So 100 study. Yeah, 100 study, but over 200 investigators. It's really large projects. So over 200 researchers came together, tried to replicate 100 studies, and they found that actually in 50% of the cases, they were like, okay, we've got the recipe, we got a different cake. How is it? And it's even worse when you look beyond social sciences. And in the area of oncology, which is cancer research, it's even worse because it would appear that actually 60% of studies are not replicable. So moving from 40% in economics, 50% in psychology, and 60% in oncology. Now, second question, is research transparent? Remember I told you transparency is about questions like, why do you report this analysis and why don't you report other analysis? Did you perform other analysis? So this is a problem that is known in the community as publication bias. Publication bias is when you publish some analysis and you don't publish some other analysis. Now, think about it. When you're an evaluator, an evaluation has, to simplify, three outcomes. You can find that your intervention has either a positive and significant effects, or it could be that your intervention has no significant effects in any direction, or it can be, to simplify, that your intervention has a negative and statistically significant effect. If, as an evaluator, you report honestly all the analysis that you performed, you would probably expect to see some analysis that show a positive and statistically significant outcome, results, some studies showing insignificant results, and then some studies negative and statistically significant results, right? And if you further assume that, the data is normally distributed, you would probably expect to see more studies that have a small effect, around zero, right? And then fewer studies on both sides of the distribution, right? So maybe this is what you would expect if you assume that evaluators report everything that they find. Well, actually, according to studies on publication bias, this is absolutely not the case. So the study that I showed earlier, this one, this large project about reproducibility in psychology, so they tried to replicate 100 studies. 97% of these studies found a statistically significant effects on the primary outcome of the study. Now, I don't remember if I should read the study again, but I can't remember if that includes negative statistically significant and positive statistically significant. I don't remember, but my guess is that, based on the research that I've read, my guess is that a very large proportion are actually positive and statistically significant results. So it would appear that, and if you've done systematic reviews like I have done myself, you would be surprised to see the incredible number of studies that reported positive and statistically significant effects. Not something you would expect if you think that we, as evaluators and researchers, we publish all the results or all the analysis that we perform at the office behind our computer. So how much is it a problem? How much do scientists know about this? I would say that there is case for action here because scientists know about this, or at least some researchers know about this. In this study published in Nature recently, I think it was 2 years ago, the authors surveyed 1,500 scientists, and I think all of them were based in the United States. And 70% of the respondents said that they themselves tried to, at one point in their career, replicate a study done by a colleague. Right, 70%, I think it's quite high, I didn't expect that. But half of them said that they could not fully replicate, i.e. come to the same conclusion, right? So there is now, I would say, some awareness of the problem. So now moving on to the last part of the talk, what can we do about it? I would suggest there's a number of solutions, and I think that the best solution to the problem of transparency and reproducibility is actually to change the ecosystem. So I think it's about a culture change. But here I want to focus on two particular interventions. First, I think that every impact evaluation should be, and this is something I'd like to discuss with you, so I'd like to know what you think. I think that every impact evaluation should be based on a PAP. A PAP is a pre-analysis plan. It's also known as the protocol. So it's, before you do the analysis, you clearly outline, you have a document saying what you're going to do, what's your research question, what are the outcomes that you're interested in, how they will be measured, what's the intervention, etc. And I think that every impact evaluation should be based on a pre-analysis plan, and this pre-analysis plan should be published or pre-registered. It's the same thing. Registered, published, the same thing. And secondly, I think going even further, I would argue that research is a public good, and that all files that are part of a research project, especially when it's publicly funded, should be in the open and should be shared with the research community so that people have access and understand how you made research decisions, etc. I see someone being discouraged already. What is a PAP? Just want to show you one example of PAP. This is RIDE. RIDE is an initiative, I think, supported by 3IE. RIDE is a registry of impact evaluations, and some of these impact evaluations are registered, i.e. the evaluators, before they started collecting data and doing any analysis, they published their protocol or their pre-analysis plan. And I think that the pre-analysis plan addresses both problems. It addresses the problem of transparency and it addresses the problem of reproducibility. So this document, this is the template. So this is, a 5-page document, and you have, before you start your evaluation, you say, so this is a template, there are questions, so you have to report, okay, what is the intervention, who is the population, what are the outcomes, how are they measured, etc. I would say that a PAP does not need to be published or registered, but I would encourage you to do so because I think it has pre-registration has a number of key advantages. Firstly, it's an additional incentive to do your protocol well, because if you have a protocol, if your study is based on a protocol, but your protocol is never going to be published, you may think, oh, this part of my project is not very clear to me, but we'll figure it out later. I don't need to worry about it too much because anyway, no one's going to see this paper, right? So that's fine for now. We'll figure it out later. When you publish a protocol or a pre-analysis plan, it has your name, it's published, it's in the open, people can have access to it. So I think it gives you an extra incentive to think carefully your study through. So it's also an opportunity for you to get feedback, because if someone, especially when it's peer-reviewed, if someone checks your PAP, they may think, oh, this is realistic, credible, or this is unrealistic or not credible, and you might have an interesting discussion. I would say that it enhances the credibility of the study. So personally, I'm a systematic reviewer, so my job involves reading a lot of studies, including impact evaluations. And I don't know, it's just a cue, but sometimes when I see that a study is pre-registered, I'm like, oh, that looks quite serious, because I know that a lot of researchers are reluctant. Those took the trouble of pre-registering their studies, so, it sounds like they're serious about it. It also signals that work is ongoing. A research project can easily take a year or two. So it can take a year or two to publish your first interim report or final reports. Well, when you publish your PAP, your pre-analysis plan, you can have something published already 3 months after starting your project or something. And I think that it might trigger new projects and new collaboration, because it could be that actually your colleagues working in a different lab or in a different research organization will come across the PAP and say, oh, wow, this is a cool project. Maybe we should work together with this team. 2 questions: when register and where register? So when register, I would say preferably before you start collecting data, but definitely before you start analyzing data. The idea is that you pre-register your study before having any kind of idea or clue as to what you're going to find out. Otherwise, the risk of is known as harking, which is hypothesizing after the results are known. So you collect data, you analyze data, and then you make up hypotheses and pretend that actually it was, since the very beginning, that was what I wanted to do, right? I think, I've seen that. I think it's not too far-fetched to believe that. And where register, you've got a number of websites where you can pre-register your PAP, and RIDI, like I said, these are examples of studies of PAPs that are publicly available. Additional benefits of PAPs, I think it keeps the study simple and focused, because you really want, when you have a PAP, you don't want to think about, millions of outcomes. You really want to focus on the key research question, the key outcome, and maybe a secondary outcome, but you wouldn't a PAP pretending that they're interested in measuring, 5, 10 outcomes wouldn't be very credible. So I think it keeps your study elegant, simple, and focused. I think it's good in terms of time management, because once your PAP is published, your job as an investigator is to implement it, so to really make sure that you do what you said you would do. Importantly, and this is a point I think is really important, how restrictive is a PAP? My answer is not that much. So you can do in a study, you have confirmatory analysis and exploratory analysis. Confirmatory analysis is doing the analysis you said you would do in the protocol or in your paper, in your final report, which analysis were confirmatory and which one were exploratory, so that the reader clearly knows in which cases you had a hypothesis and in which cases you had no prior expectation. I think I'll be done in probably less than 5 minutes. And the second part of my second suggestion is that once you've done your research or your evaluation, and even as you do your research, you publish your workflow. You publish as much files as you have. So not only the data and the reports, but also the questionnaires that you used, the common files, etc., etc. So this is known as the workflow. You publish your workflow. I'm going to show you an example of a workflow diagram that I made up. A workflow diagram is the comprehensive list of all the files created in a given study and how these files relate to each other. So this is a simplified, because this is a very simplified workflow where each box is an output or a file in your folder. Imagining that this is your computer and you have a folder called Research Projects X. Well, it would have included pertain to your the literature review part of your study. So, for example, it could be that you have a spreadsheet of all the studies, similar studies that have been conducted in the past on the same research question. Then on sampling, under sampling, you have several files. Maybe you want to report the results of your power calculation. Maybe you have some other files that you want to share. For the variables part of the paper, you may want to publish a file called the codebook, so what the variables measure and how they were measured. Then you may want to publish your baseline survey questionnaire, your endline survey questionnaires, and so many more files that you may want to share. For the data part of your reports, you may want to publish the raw data, so the data as you collected it. The processed data, so after some cleaning and some checking and converting variables or changing the scale of variables. And also, for example, the command files. So how the do file, if you use data, so the command file that's transform the raw data into the processed data. And for the results are often tables of statistical outputs and graphs. That would be, I think, a very good idea for you to publish the command file that gives you table 1, the command file that gives you figure 1, so that the peer reviewer or anyone else who is interested in your research can just run your command file and see if indeed it comes to the same results. It may sound obvious, but remember that all the researchers who've done that before, they say, well, we did what we thought the investigators did themselves, and actually we get different statistical output or we get different graphs. And so this is about the architecture of your folder, but then I think it would be good to publish your files and share them. So here are a few examples of applications and programs where you can store all your files, right? I'm sure that many of you use already Dropbox and Google Drive, but I would recommend using this one here. It's called the Open Science Framework, and it's a collaborative platform, so which helps you store all your files, so manage your research projects, but you can also share all your files with your co-investigators. And when you feel ready, you can make it publicly available and searchable through search engines. So, for example, if I search, evaluations of water sanitation programs, and if your research, all your files are on the OSF, your OSF webpage will come up, and the researcher will have access to your files. So this is what it looks like, and I'm going to make a very open science framework, and I'm going to show you very briefly, my own OSF webpage. So on my OSF, each study has a different sort of webpage, I guess, or repository. It's known as a repository. For example, last year I published a study on sampling bias in evaluations of employment studies. And here you can see that within this repository called study on sampling bias, then I have folders, just like I have in my Dropbox. Some folders contain my data, so for example, if I click here, well, you have to believe me. If you click there, you can get my data sets, basically. Okay, never mind, you have to believe me then, because I can't show it to you. So the OSF mirrors my Dropbox in the sense that not all the files that are in my Dropbox are also in the OSF, because my research is not as clean as I wish it was. I mean, there's still some messiness that I'm trying to address. But ideally, we would want the OSF to be as comprehensive as the Dropbox, because we want to share virtually everything with our colleagues. Main features of the OSF, I think I've already mentioned that. So you decide, so you can share, unlike Dropbox and Google Drive, you can share your research files not only with your colleagues but with the wider world. So I think that's great. You can also keep track of changes to your files. So I don't know how you work, but for example, how I worked not so long ago. So for each file, so not only have a lot of files in my research projects, but for each file I have different versions, like version 1, questionnaire V1, questionnaire V2 after some changes, V3, questionnaires final, questionnaire final, and then questionnaire final as published. Okay, this is a bit confusing, right? With the OSF, the good thing is that everything is in one place, and the program keeps track of all the history of changes, but it's in just one single document. It's like Words keeps, track of the changes, but OSF doesn't need to be based on Word, so you can have a TXT, a text file that is not based on Word, where you can track changes. But same with spreadsheets, same with any kind of format, so I think that's quite a cool feature. And unlike Dropbox and Google Drive, OSF is compatible with other applications and programs that are specific to researchers. So it's really specific to researchers, like GitHub, Mendeley for literature reviews, R, etc. And it also includes a pre-registration service. If you want to know more, if you want a longer introduction than the 2 seconds or 1 second that I could show, so there is a 60-minute tutorial on the OSF on YouTube. That's it. So 2 solutions, pre-analysis plans and publishing your pre-analysis plans, and then have a publish your files or research files online. The reason I'm using, I don't have shares in OSF. That's why I didn't pick this particular program because I have a vested interest in the OSF. I picked that one in particular. There are other programs, but I use that one in particular because it's the one that I use myself, and because it's open source, free of charge, and it's not the case of all collaborative platforms. Thank you very much.